Well, hello, and welcome to another edition of JC Lee MD Minute on my channel. I'm your host, Jonathan Jacha Lee, a quadruple board certified child and adolescent psychiatrist, Torontonian and Pisces, living and working in Los Angeles. And on this portion of my channel, I dispense some shrink-wrapped advice, kind of the counseling that I would probably give to some of the patients that I see. And on that note, none of this advice should be taken as a substitute for individualized mental health professional care. And so please do not write to me and tell me that things have gone awry. This really is just for informational purposes alone. And to some extent, I'm talking to those, young people who are becoming child and adolescent, and also, adult psychiatrists as well. So please do bring up this information with your doctor if it feels like it pertains to you. And of course, watching this video doesn't constitute a physician-patient relationship with me. Although you're more than welcome to reach out for a consult. Today, as far as, what I'd like to share on, I'd like to talk a little bit about sexual side effects and selective serotonin reuptake inhibitors, or SSRIs. So these are medications like Fluoxetine or Prozac, Escitalopram or Lexapro, Sertraline or Zoloft that tend to be considered first line for, depression, anxiety, OCD, trauma, and the like, because of their generally very great side effect profile. But one of the really persnickety side effects that tends to persist with these medications, and in particular at higher doses, are sexual side effects. And these happen because as we block some of the serotonergic receptors in the brain, we're also going to influence some of the receptors in the spine. And those are responsible for those really wonderful things like vaginal lubrication, like libido, like erections, and orgasm. So for a lot of women who are on these medications, there's just more difficulty with lubrication and delayed or absent orgasm and lowered libido as a result of these meds. And for guys, sometimes that can look like erectile dysfunction, lowered libido, and also delayed ejaculation, which some guys really, really do like. So if these side effects are present, they are unlikely to just go away. In a minority of cases, maybe 15 to 20%, simply staying on the medication a bit longer can get your body tuned to it. But the vast majority, about 80%, will continue to have these side effects unless we do something about them. And the things that we can do with regards to sexual side effects are many. I had previously talked about sort of lowering the dose, because again, the higher in a different video, because again, the higher the dose, the more likely the side effect. Another option is to swap one medication out for another. So for instance, on a conglomerate kind of basis, or at least in my practice, I would say Lexapro or Escitalopram tends to have less of these sexual side effects than medications like Sertraline, Zoloft, or Paroxetine or Paxil, which I don't even prescribe. And by the way, I have no shares in GlaxoSmithKline, Forest, Wyeth, or any other pharmaceutical company, and nobody is paying me to say these things. And so sometimes it is just a matter of switching from one SSRI to another close cousin of relatively equivalent dosage, and we can find that the sexual side effects really lift. Another option is to add in a different medication on top of, so layer on top of the SSRI if we're really liking the effect and otherwise there's no other problem with continuing it. We can add in a different medication. And in this case, at least my personal preference is to start with something like bupropion or Wellbutrin. Bupropion is an NDRI, so it affects both norepinephrine and dopamine and their reuptake. And so it works as a complementary kind of medication to the SSRI, which tends to work primarily on serotonin. And so you get a triple hit with all of the monoamine neurotransmitters. Bupropion It has many merits as an antidepressant, probably not going to be so effective in the case of anxiety, but if you're on an SSRI for anxiety, presumably that's going to, do the trick. But what bupropion tends to do is that it tends to improve mood, concentration, energy, motivation, and also reverse some of the sexual side effects that we can see in people on SSRIs. Another option is to consider something like mirtazapine, which is a NaSSA. It is a noradrenergic and specific serotonergic antagonist. And so this can actually work on both norepinephrine and serotonin to reverse some of the sexual side effects. Mirtazapine has efficacy as both an antidepressant and anti-anxiety medication. It tends to have some potential for drowsiness, weight gain, and it really helps people get to sleep. So it's often used on medical floors with older people, especially if they're having difficulty with eating and sleep and all of that. But for the average young person, I think the prospect of weight gain is somewhat daunting, and that coupled with, an additional SSRI, which in most cases, with the exception of, I would say, fluoxetine and potentially Lexapro or Escitalopram, most cases you're going to experience some potential weight gain, at least minimal or marginal. So all of that to say, bupropion and mirtazapine are two potential options that will also help, along with any, residual depressive or anxiety kinds of symptoms on top of the sexual side effects that you're getting from your SSRI. Another option, and this is more so for the guys than for the women, although I do know that people have used these in women as well, is to try something like sildenafil or tadalafil, so commonly known as Viagra or Cialis. And these can be taken, at varying intervals when you know that you're going on vacation or, sexual activity is more likely as a precursor. So in a sense, treating it as like bona fide, organic erectile dysfunction. And of the two, of course, there are merits, pros and cons to both, in terms of cost, in terms of availability, in terms of ease of use. But that's something that you could definitely talk with your primary care physician about. So in summary, as far as sexual side effects go, they tend to affect, a reasonable proportion of between 30 to up to 50% of people who are on SSRIs. Sex is important. It's a big deal of human life and the enjoyment of it. And so, at least in my practice, we really talk about the potential for these side effects to happen and what we can do with them if they do happen. Because again, the message here is not that you immediately have to stop the medication, although if you did, you would very likely recuperate your sexual functioning to normal levels. The messaging here is that there's often something that we can do, either by lowering the dose ever so slightly and maintaining some of the therapeutic benefit while eliminating the sexual side effect, or swapping one medication out for another, because not all medications have the same risk of sexual side effects in the same person. We just don't know which one will have what risk in you until we do it. Or adding in a secondary medication to layer on top of it, not only for, potential antidepressant or anti-anxiety effects, but to reverse some of the sexual side effects that come along with SSRIs. So there you have it, a really cursory but hopefully helpful lay of the land vis-a-vis treating sexual side effects with SSRIs. Until next time, take care of yourself and love yourself.